Hello. Parkinson's disease is a progressive disease that begins with the destruction of certain cells in the brain. The exact cause of Parkinson's disease is not known. In most patients, no real cause is observed. However, a genetic cause was found in about 20% of them. Symptoms of Parkinson's disease are slowing down in walking, walking with short steps, trembling in the hands and contractions in the muscles. In addition, there are also many other symptoms such as swallowing difficulties and olfactory disorders. Treatment of Parkinson's disease begins with medication. There are specific drugs produced for this disease. These drugs are effective in the treatment of the disease for a short or long period. However, over the years, drugs may lose their effectiveness and side effects may occur. In this phase, surgical treatment methods, brain battery implants, and deep brain stimulation will be some of the ways in which we treat patients. Surgical treatment of Parkinson's disease has been discussed for more than half a century. It started in the last century. Brain batteries, on the other hand, have been used very actively and routinely for the last 25 years. Brain batteries are also used in diseases such as tremor or dystonia in convulsions. Apart from Parkinson's disease, brain battery surgeries should be performed specifically in the middle stage of Parkinson's disease, that is, during the period when the side effects of the drug therapy appear or are insufficient. What I want to emphasize here is that this should be done in the middle stage of the disease, not in the last stage. I mean, when the patient is in a better condition before they get worse. The benefit for each patient is different. However, a long-term and significant improvement occurs in approximately 90% of the patients who are treated in the appropriate stage before it is too late. Let me talk about the improvement we observe. A 50% improvement in Parkinson's score is expected, and a 50% dose reduction of drugs is expected. This is, of course, a rate that varies from patient to patient. I have been dealing with the treatment of Parkinson's disease for nearly 30 years. During this time, I performed the surgeries of approximately 1,500 patients with Parkinson's, and I performed brain stimulation treatments in significant number of them. Various treatment experimental methods are applied in the treatment of Parkinson's disease. These may have a chance to be used for treatment in the future. However, there is currently no effective method that has entered routine practice. The most effective of these methods is the application of a brain battery. The technical name for this is brain battery stimulation. What I would especially like to say to Parkinson's patients is this: surgical treatment and brain battery applications have an important place in the treatment of the disease. It is especially important to keep in mind that these types of procedures should not be performed in the last stage of the disease or during the worsening of the disease, but in the middle stage, that is, during the period when the patient has not deteriorated yet and responds to drugs. I wish you all happy and healthy days.